1. Unexplained fatigue or asthenia, fevers, and depression. The most common, yet also most overlooked symptom of pancreatic cancer is a persistent feeling of weak, tired, and unwell that doesn't lift with rest. That's because about 80% of patients develop cachexia, a condition that causes increased energy use and major weight, muscle, and fat loss. With less energy and strength, it's no surprise that fatigue sets in. The cancer itself consumes energy as it grows. Also, the cancer saps energy by increasing inflammation or disrupting nutrient absorption, while poor digestion might lead to anemia, lack of red blood cells, over time. With fewer calories absorbed due to enzyme loss and the body fighting the tumor, you're left drained. Gentle activity and nutrient-rich snacks might perk you up a bit, but doctors can check for underlying causes. Since fatigue is associated with countless conditions from anemia to depression, it's rarely the lone symptom that leads to diagnosis. But it shouldn't be dismissed, especially when accompanied by other warning signs we'll mention later in this video. If you're experiencing unusual fatigue, tracking your energy levels and sleep patterns can help your doctor evaluate the symptom. Fatigue can creep in during early stages 1 or 2, but it's often more debilitating in late stages 3 or 4 as the disease progresses. Unexplained fevers and frequent infections can also be significant, yet often overlooked symptoms of pancreatic cancer. These symptoms arise because the cancer disrupts normal immune function. Besides vague signs like fatigue or fever, some research suggests that depression may be an early symptom of pancreatic cancer rather than just a psychological response. In fact, pancreatic cancer also has the highest rates of major depression among cancers. While the connection might seem surprising, there's emerging evidence suggesting that pancreatic tumors can release substances that affect brain chemistry and mood. Additionally, the pancreas has rich nerve connections that, when disrupted by a tumor, may influence emotional well-being through complex neural pathways we're still working to understand. To boost your mood and your energy levels, avoid long periods of sitting. Try to stand up and move every 40 minutes. You can engage in light activities like stretching, walking, gardening, housework, or even simple exercises in bed. Remember to move at your own pace and push yourself slightly so you're a little out of breath. Eating well and staying hydrated is also important to maintain your energy levels. You can also conserve energy by planning tasks and doing them when you feel best, taking scheduled rest periods, and sitting down while cooking, washing, or grooming. Recharge yourself through enjoyable activities such as spending time in nature, doing gentle yoga, or practicing progressive muscle relaxation. Many people also find peace through mindfulness practices like guided visualization or qigong, like Tai Chi and Falun Dafa. Among these, Falun Dafa, also known as Falun Gong, stands out with its transformative benefits: enhanced physical health with more energy and immunity, improved mental well-being with better sleep and emotional balance, and personal growth through stronger relationships and a deep sense of purpose. While Falun Gong is not a medical treatment for cancer, many real-life cases show that practicing it has helped people recover. A 2016 study by the American Society of Clinical Oncology found that practicing Falun Gong can greatly extend the survival of terminal cancer patients. Researchers analyzed 152 cases of late-stage cancer, mostly lung, liver, pancreas, and stomach, from 2000 to 2015 in China. All patients started practicing Falun Gong after being diagnosed, or their treatment failed. Out of 152 patients, nearly 97% reported full symptom recovery, with improvement starting in about 1.3 months. Patients expected to live only 5 months survived an average of 56 months, over 4.5 years, after practicing Falun Gong. Today, Falun Gong is practiced by people in over 100 countries across the world. If you are interested, you can learn it for free at learnfalungong.com. However, before you probe deeper, we believe it's important to mention that some online sources contain misleading claims and negative portrayals of this practice. That's because Falun Gong, despite originating in China, has been the target of defamation and persecution by the Chinese Communist Party, or CCP. Many international media outlets pick up these false narratives from Chinese state media, without knowing the full story. Furthermore, reports suggest that funds have been used to influence individuals, groups, and media in the US to discredit Falun Gong. Recently, a YouTuber with 4 million subscribers and 3 billion views revealed this manipulation campaign in an interview.
China started hiring YouTubers. They offered, I'm pretty sure I got offered this at some point. I got an email where they were like, we'll give you $200 to post this video to your YouTube channel. And then I looked at the video and it was a guy being like, these really weird people, Falun Gong, like, what's this about? And then it was like a mini doc that was like 5 to 10 minutes long from some white dude complaining about this group. And I'm like, I ain't posting that to my channel. What is this? But a lot of people were like, $200, I'll take it.
This appears to be part of a broader campaign to turn the American and global public against Falun Gong and justify the inhumane persecution in China over the past 26 years. In 1999, with Falun Gong practitioners exceeding party members in number, the CCP found Falun Gong's emphasis on truthfulness, compassion, and tolerance, and the belief in the divine, a threat to its atheist regime, which maintained power through control and suppressing faith. A nationwide crackdown was launched, with state-controlled media defaming Falun Gong, undermining public support for the practice, and police forces arresting and detaining practitioners illegally. Reports reveal cruel forms of torture in prisons, even sexual abuse, all to force people to give up their faith. One of the most serious accusations, backed by multiple investigations, is that Falun Gong practitioners have been killed for their healthy organs, fueling a massive transplant industry worth around $1 billion per year. Sadly, the persecution of Falun Gong has persisted to this day and even spread beyond China. If you want more detailed research and documentation about this subject, consider visiting faluninfo.net. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. Besides Falun Gong, we're happy to hear about other practices you found helpful for cancer patients in the comments section. Now, let's continue with the second subtle sign of pancreatic cancer that often appears years before diagnosis. 2. Unexplained rapid weight loss. One of the earliest and most common signs of pancreatic cancer is unexplained weight loss. In fact, about 85 to 90% of people have lost weight by the time they're diagnosed. Even in the early stages, nearly half experience weight loss before surgery. You might notice your clothes fitting more loosely or that you're losing pounds, even if you're eating as usual. No diet, no extra exercise. This happens because pancreatic cancer impacts your body's metabolism in several ways. The tumor itself consumes energy, creating a caloric deficit. Cancer can also make you less hungry, change how food tastes, or make you feel full too quickly. This can lead to eating less, a big reason why many people with cancer experience malnutrition. More importantly, when cancer affects the pancreas, it can reduce the production of pancreatic enzymes that help break down fats, proteins, and carbohydrates in your diet. Without proper digestion, many nutrients pass through your body unabsorbed, leading to unintentional weight loss even when your appetite remains normal. This symptom can begin appearing early, in stage 1 or 2, but becomes more pronounced in later stages. Medically, unexplained weight loss, defined as losing more than 5% of your body weight within 6 to 12 months without trying, is considered clinically significant. To put it in perspective, a person weighing about 200 pounds could lose 10 pounds within just some months. If you're experiencing this symptom, track your weight changes and eating habits to share with your doctor. Try to avoid high-calorie supplements. Management strategies include working with a registered dietitian to create a high-calorie, nutrient-dense diet. Staying active with light exercise is important, while long periods of inactivity should be avoided. In some cases, one may need appetite stimulants. Your doctor might also prescribe pancreatic enzyme supplements, such as Creon and Nutrizim 22, to improve digestion and nutrient absorption. Remember, while unexplained weight loss can have many causes, it's always worth investigating with your healthcare provider. 3. New-onset diabetes. It is well known that long-term diabetes increases the risk of pancreatic cancer, and recent studies also reveal that newly developed diabetes may also be an early sign of the disease. If someone over 50 suddenly develops diabetes without a family history, It could be due to pancreatic inflammation or dysfunction, pointing to pancreatic cancer, especially pancreatic adenocarcinoma, or PDAC, the most common type of pancreatic cancer. Your pancreas produces insulin, the hormone that regulates blood sugar levels. When cancer cells invade the pancreas, they can damage the insulin-producing cells, leading to impaired glucose tolerance and eventually diabetes. This is often accompanied by the classic diabetes symptoms: increased thirst, frequent urination, blurry vision, and unusual fatigue. What makes this particularly suspicious is when diabetes appears suddenly without obvious risk factors like obesity or family history. If you notice these symptoms, ask your doctor or nurse to check your blood sugar. If it's high, treatment can help manage these symptoms. This symptom can appear at any stage, but is sometimes present 2 to 3 years before other cancer symptoms emerge or being noticed, making it a potentially valuable early indicator. In a 2008 study published in Gastroenterology, diabetes was much more common in pancreatic cancer patients, 47%, than in those without cancer, 7%. Among those with new-onset diabetes, 74% of pancreatic cancer patients had developed it within the last 2 years. 57% saw their diabetes disappear after tumor removal. A more recent 2018 study also revealed that 80% of new-onset diabetes cases showed no cancer symptoms at the time of diabetes detection. Still, about 33% of new diabetes cases go undiagnosed. If you've recently been diagnosed with diabetes, especially if it seems to have come on suddenly or without explanation, discuss this with your doctor to see if you need to get a full workup. While most cases of new diabetes are not caused by cancer, your doctor might consider additional screening if other risk factors or symptoms are present. Management includes standard diabetes care: monitor blood sugar, cholesterol, and pressure. Stop smoking, get medication, sleep well, exercise, and opt for a healthy diet. But also requires vigilance for other potential pancreatic cancer symptoms. Regular follow-ups with both your primary care physician and endocrinologist are essential to monitor your condition properly. 4. Yellow skin, also known as jaundice, and itchy skin, also known as pruritus. Patients with PDAC often show painless jaundice, about 50% of cases. This is when your skin or the whites of your eyes take on a yellowish tint, and it's a telltale sign that something might be wrong with your biliary system. In pancreatic cancer, the tumor can press against the bile duct, blocking the flow of bile, a fluid, from the liver to the small intestine. Normally, bilirubin, a yellow-orange substance made in the liver, is released in bile to aid digestion. If the bile duct is blocked, bilirubin cannot leave the body and builds up in your bloodstream, leading to jaundice. Jaundice can appear early in stages 1 or 2 if the tumor is in the head of the pancreas close to the bile duct, making it a potential early clue. However, cancers in the body or tail of the pancreas usually do not block the duct until they have spread, making them harder to detect early. If pancreatic cancer spreads to the liver, it can also cause jaundice. Besides yellowing of the eyes and skin, itchy skin, especially on your hands or feet, is another sign that bilirubin levels rise in your body. Itchy skin often pairs with early jaundice in stages 1 or 2 for head tumors, though it can also appear in stage 4 where the tumor metastases to the liver. These symptoms are diagnostically significant because it often prompts medical investigation that can lead to cancer detection. If you notice yellowing of your skin or eyes or itching, contact your doctor immediately. Treatment for jaundice typically focuses on relieving the blockage, usually through a procedure called a biliary stent placement, where doctors insert a small tube, called a stent, to reopen the bile duct. At home, staying hydrated, avoiding alcohol, soft drinks, or fatty foods can reduce strain on your liver. But you'll want to see a specialist quickly. Professional medical intervention is essential. Bland emollients, topical steroids or menthols, ice compresses, or antihistamines might soothe itchy skin temporarily. It's best to use moisturizers immediately after bathing. Limiting water exposure, hot showers, harsh soaps, and irritants like pet dander and wool may also help somewhat, but doctors can address the root cause. Don't forget to see one if it's ongoing. Are you enjoying our video so far? If so, please give us some hints by dropping a like. and we'll make more content like this. 5. Dark urine and pale, greasy stool. Beside jaundice, other symptoms of bile duct obstruction, such as dark amber, tea-colored, or cola-colored urine and light or clay-colored and oily stools that are hard to flush, were linked to earlier stage diagnoses for pancreatic head tumors. If you develop any of these warning signs, consult a gastroenterologist as soon as possible, as they suggest potential pancreatic, gallbladder, or liver disorders that shouldn't be ignored. This is very important, as these early warning signs of pancreatic cancer are easily overlooked or attributed to dehydration. This darkening urine occurs primarily when blocked bile ducts keep bilirubin from being excreted through the intestines. Instead, this bilirubin is filtered through the kidneys and excreted in urine, causing the characteristic dark color. While temporary darkening of urine can indeed be caused by dehydration, certain medications or foods like fava beans, rhubarb, or aloe, persistent color changes lasting more than a few days warrant medical attention. It's helpful to monitor and document when you notice the color change and any patterns related to meals or medications. Now, how about the pale, greasy, offensive-smelling stools? The liver releases bile salts that give stool its normal brown color. If you have a blocked bile flow due to pancreatic cancer, your stool may turn clay-colored. It's not just about blocked bile ducts. Enzymes play a big role too, as the pancreas produces enzymes crucial for fat digestion. When the pancreas doesn't produce enough enzymes due to cancer, fats go unprocessed in your gut. This can cause excess fat in the stool, leading to pale, large, foul-smelling, loose stools. Enzyme supplements from a doctor can help, and avoiding fatty foods might ease it, but get it checked out. Pale stools and dark urine can show up in early stages 1 or 2 when the tumor begins affecting the bile duct, becoming more obvious in later stages 3 or 4. What makes these symptoms particularly important is that they often appear together with more obvious signs like yellowing of the skin, also known as jaundice, potentially allowing for earlier detection of pancreatic cancer. You might also experience diarrhea or constipation that doesn't seem to have a clear cause or doesn't respond to usual remedies. Be careful with any changes in your bowel habits. Management primarily involves treating the underlying bile duct obstruction, as with jaundice. Pancreatic enzyme replacement therapy and a low-fat diet can also significantly improve digestion and reduce these symptoms. 6. Abdominal pain, dull or aching. Belly pain is very common in pancreatic cancer, with about 75% of people with PDAC experiencing it. In fact, pancreatic cancer is often diagnosed when patients seek help for abdominal pain. This pain can start subtly in early stages 1 or 2 with a small tumor, though it tends to ramp up in intensity by stages 3 or 4 as the cancer spreads. Abdominal pain related to pancreatic cancer typically presents as a dull, aching discomfort in the upper abdomen, often centered below the ribs. Sometimes, the pain occurs in the right or left upper abdomen. This pain occurs because, as the tumor grows, it can press against nearby organs and tissues in the abdominal cavity, irritate nerve endings, or cause inflammation in surrounding tissues. The pancreas sits deep in the abdomen, behind the stomach, and in front of the spine, which explains why the pain often feels deep and centralized. If the cancer involves inflammation of the pancreas, or pancreatitis, patients may have severe, constant, and unrelenting pain. Some call it gnawing or grinding. It worsens after eating, and many patients avoid meals to prevent pain, leading to malnutrition and digestive issues. A distinctive characteristic is that this pain often doesn't respond well to over-the-counter pain relievers, like acetaminophen or ibuprofen, setting it apart from more common causes of abdominal discomfort. Management strategies include prescription pain medications tailored to the type and severity of pain you're experiencing. Pancreatic cancer pain is frequently classified as moderate to severe and neuropathic, often requiring stronger interventions like opioids, like morphine or oxycodone, or nerve blocks. Since strong treatments can sometimes make symptoms worse, pain management in pancreatic cancer can be really tough. Worse still, while there are many pain relief options, clear guidelines and information on side effects are still missing. Positioning changes, such as sitting slightly forward or sitting up, can sometimes relieve pressure on the pancreas and reduce discomfort. Heat therapy through warm compresses may help relax tense abdominal muscles, providing some temporary relief. Your doctor might also recommend eating more whole, antioxidant-rich foods and avoiding alcohol, large meals, and high-fat foods, which require more pancreatic enzymes for digestion and can exacerbate pain. Since abdominal pain has countless causes from the benign to the serious, it's the persistence and progression of the pain that raises concern. Discomfort that lasts more than a few days or gradually worsens over weeks merits medical attention. 7. Back pain. A tumor in the body or tail of the pancreas can grow large and press on the spine, causing pain. The pain affects 75% at diagnosis and over 90% in later stages. Sometimes, the pain in the middle of the abdomen spreads to nearby nerves, leading to back pain. The pain might start subtly in stages 1 or 2, but it's more common and intense in stages 3 or 4 with larger tumors. Back pain associated with pancreatic cancer has distinctive characteristics that set it apart from common mechanical back problems. Unlike mechanical back pain, it's typically unrelated to movement or position changes and doesn't respond well to common back pain remedies like anti-inflammatory medications. Why? As a tumor grows, it can directly press against spinal nerves or invade surrounding tissues and nerve plexuses. The pain from this typically manifests as a persistent, deep, and dull ache in the middle or upper back, sometimes described as a band of pressure or discomfort that wraps around from the abdomen to the back. A telltale feature of pancreatic cancer-related back pain is that it often worsens after eating or when lying down, and may improve somewhat when leaning forward or rubbing back, which relieves pressure on the pancreas. Don't fret yet. Most back pain is caused by other conditions like muscle strain, not pancreatic cancer. However, pain that persists for more than a few weeks, doesn't respond to conventional treatments, or wakes you from sleep, especially if it's accompanied by other symptoms we've discussed, should be evaluated by a healthcare provider. Management approaches include prescription pain medications, which your doctor will select based on the pain's severity and your individual needs. For some patients, a procedure called a celiac plexus block, where medication is injected around nerves to interrupt pain signals, provides significant relief. Physical therapy focusing on gentle stretching and strengthening of the core muscles can help support the spine and reduce secondary muscle tension. Both heat and cold packs can help with the pain. Heat works best for nerve pain, while cold helps with inflammation. Position adjustments, particularly sitting slightly forward, may provide temporary comfort. 8. Gas and bloating, feeling full, and ascites. Persistent bloating or feeling uncomfortably full after eating small amounts of food can be a subtle indicator of pancreatic cancer that's often mistaken for more common digestive issues. You might notice your clothes feel tight, your abdomen becoming visibly distended, particularly after meals, or feeling uncomfortably full after eating just a few bites, a condition called early satiety. This symptom occurs when the tumor presses against the stomach or surrounding organs. This can leave your gut sluggish and distended, reduce stomach capacity, or slow digestion, trapping gas in food and causing a bloat. Additionally, if the cancer interferes with the production of pancreatic enzymes, food remains partially undigested, leading to bacterial fermentation in the intestines that produces excess gas and bloating. Note that bigger belly isn't always just from gas. If cancer spreads to the liver, stage 4 pancreatic cancer, it can cause fluid buildup, called ascites, making your tummy swell and stretch out. In this case, doctors can drain the fluid using a small tube, guided by an ultrasound if needed, to help relieve discomfort. This symptom can begin in early stage 1 or 2 with minor pressure, but becomes more noticeable as the disease progresses. While occasional bloating affects everyone, symptoms that persist for more than 3 weeks, that recur more than 12 times a month, or that worsen over time deserve medical attention, especially if you notice a swelling or lump in your tummy. To manage this symptom, try eating smaller, more frequent meals rather than 3 large ones, and avoid carbonated beverages and processed, sugary, spicy, or fatty foods. Be careful with gas-producing foods like beans, lentils, and cruciferous vegetables like cabbage and artificial sweeteners, which can exacerbate bloating. Gentle physical activity after meals can help move gas through the digestive system. Your doctor might recommend over-the-counter medications like simethicone to reduce gas bubbles or prescription medications to improve gastric emptying. Pancreatic enzyme supplements can significantly help if insufficient enzyme production is contributing to the problem. 9. Loss of appetite, or anorexia. Loss of appetite, or anorexia, is a common but often overlooked sign of pancreatic cancer. This symptom can appear at any stage. You might notice a general disinterest in food and weight loss, feeling satisfied after just a few bites, or experiencing aversion to foods you previously enjoyed. This happens through several mechanisms. The growing tumor can release substances called cytokines that directly suppress the hunger signals in your brain, like the hormone ghrelin, while also triggering nausea and early satiety. The cancer may also press against your stomach, creating a feeling of fullness even when you haven't eaten much. Additionally, changes in taste perception are common, with some patients reporting that food, especially meat, tastes bland or metallic, further diminishing eating pleasure. While occasional appetite fluctuations are normal, persistent loss of appetite lasting more than a week warrants medical attention, especially when accompanied by weight loss and fatigue. Management strategies include eating small, frequent meals and snacks rather than 3 large ones, which can feel overwhelming when appetite is poor. Cold or room temperature foods often have less aroma and may be more appealing than hot dishes with strong smells. Also, if food smells put you off, stay away from the kitchen while meals are being prepared. Your doctor might prescribe appetite stimulants like corticosteroids, Magestrol, or dronabinol in some cases. Plus, experiment with new foods, as your taste may change. Sharp flavors, such as grapefruit, lemon, or bitter lemon, can stimulate taste buds and saliva flow. Incorporating light physical activity before meals can naturally boost appetite, while working with a dietitian to find bland, full-fat, high-protein, or fortified foods and high-calorie drinks that appeal to your changed preferences can help maintain nutritional status. Eat what you feel like eating, even at unusual times. Try to drink plenty of fluids, but avoid large amounts before meals. Or else try liquid meals like fruit juices or soup broths. 10. Unexplained nausea and vomiting. Persistent nausea and occasional vomiting that can't be explained by common causes like food poisoning or stomach viruses might be a sign of pancreatic cancer. As a tumor grows, it can create pressure on the stomach and duodenum, the first part of the small intestine, causing a partial blockage that makes it difficult for food to pass through the digestive tract. Additionally, the cancer can interfere with normal pancreatic function, disrupting the production of digestive enzymes and further contributing to digestive discomfort, as we explained before. You might notice that nausea worsens after eating, especially following larger or higher fat meals. These symptoms typically emerge in stage 2 or 3 pancreatic cancer and become more pronounced as the cancer advances. While everyone experiences occasional nausea, symptoms that persist for more than a week or that repeatedly occur without an obvious cause should be evaluated by a doctor. They may adjust your medication or prescribe anti-sickness medication, which works best when taken regularly, especially 30 minutes before meals to help you eat more. If a tumor is causing a physical blockage, a stent might be placed to keep the digestive tract open. Dietary modifications can also help. Eating smaller, more frequent meals, avoiding hot, fatty, or spicy foods, and staying upright after eating can all reduce symptoms. Some patients find relief through integrative approaches like ginger or peppermint tea or acupressure bands. Try to get fresh air, avoid strong-smelling foods, and choose plain, cold, or soft foods, which may be easier to eat. 11. Blood clots, unexplained swelling or pain. Sudden leg swelling, redness, warmth, or pain, which are signs of a blood clot or thrombosis, can quietly point to pancreatic cancer, especially without an obvious cause like recent surgery or prolonged immobility. In fact, a blood clot in a large vein, usually in the leg, which is called deep vein thrombosis, or DVT for short, can sometimes be the first sign of pancreatic cancer. A 2019 study reveals that pancreatic cancer has one of the highest risks of blood clots, with up to 36% of patients experiencing clotting complications. The cancer produces proteins and other substances that make blood stickier, increasing clot risk. These proteins, like tissue factor and autoantibodies, trigger clotting in veins, often in the legs, DVT, even without injury. Additionally, inflammatory responses triggered by the cancer can damage blood vessel walls, creating ideal conditions for clots to form. When noticing this, you can elevate the leg and seek urgent care. Doctors might use blood thinners, but it's a red flag worth investigating. This can occur in early stages 1 or 2 as a rare early sign, but it's more frequent in late stages 3 or 4 with advanced disease. Medically, an unexplained blood clot, especially in someone over 50 without traditional risk factors, is significant enough that many doctors will include pancreatic cancer in their differential diagnosis. If you develop symptoms of a blood clot, seek immediate medical attention, as clots can be life-threatening if they travel to the lungs. Treatment typically involves blood-thinning medications to dissolve the existing clot and prevent new ones from forming. Your doctor will likely recommend regular follow-up appointments to monitor the effectiveness of treatment and may suggest lifestyle modifications like avoiding prolonged sitting and smoking and staying well hydrated. While many blood clots are not caused by cancer, this unusual symptom always warrants thorough investigation, especially when other risk factors aren't present. Prevention and early detection. While we can't prevent all cases of pancreatic cancer, there are meaningful steps you can take to reduce your risk and increase the chances of early detection. Smoking is the single most significant modifiable risk factor. If you smoke, quitting now can substantially lower your risk. A 2020 study suggested that smokers had a 72% higher risk of developing pancreatic cancer. Plus, avoid alcohol. Another 2016 study found that drinking more than 30 grams of alcohol per day increased the risk by 22%. Maintaining a healthy weight is another powerful prevention strategy, as cancer cells rely on fat for growth. Focus on a diet rich in fruits, vegetables, whole grains, and lean proteins, while limiting red meat and processed foods. Regular physical activity not only helps control weight, but also reduces inflammation and improves insulin sensitivity, both of which may lower cancer risk. For those with a strong family history, having 2 or more first-degree relatives with pancreatic cancer, genetic counseling and testing might be appropriate. If you carry certain genetic mutations like BRCA1 or 2, or have conditions like Lynch syndrome, your doctor may recommend surveillance through specialized imaging tests. Unfortunately, there's no standard screening test for pancreatic cancer in average-risk individuals, making symptom awareness particularly important. People with suspected symptoms of pancreatic cancer first get a blood test to check for CA19-9, a protein often made by pancreatic tumors. High CA19-9 levels can suggest pancreatic cancer, but may also rise due to other conditions like pancreatitis. If abnormalities are found, more tests like an ultrasound or CT scan may be needed to examine the pancreas. However, these tests can't 100% confirm pancreatic cancer. A biopsy, where a small tissue sample is taken and checked under a microscope, is the common way to fully diagnose this cancer. Conclusion: pancreatic cancer is not necessarily a death sentence. Early detection can save lives, as this cancer often develops silently for years before diagnosis. Remember these key warning signs we've discussed: unexplained fatigue, fevers, and depression, sudden weight loss without trying, new-onset diabetes, especially after age 50, yellowing of the skin and eyes along with itchy skin, dark urine and pale, greasy stools, persistent abdominal or back pain, bloating, feeling full quickly, or digestive changes, loss of appetite, unexplained nausea and vomiting, blood clots without obvious cause. These symptoms, especially in combination, deserve attention, particularly if you have risk factors like a family history, smoking, chronic pancreatitis, or are overweight. Don't hesitate to consult your doctor and be your own advocate. Describe your symptoms clearly, mention any family history of cancer, and don't downplay your concerns. Early detection, while challenging with pancreatic cancer, remains one of our best tools for improving outcomes. Alex Trebek's legacy reminds us that sharing knowledge about pancreatic cancer symptoms can create ripples that save lives we may never know about. Remember, listen to your body, trust your instincts, and never hesitate to speak with your healthcare provider about persistent or concerning symptoms. In the fight against the king of cancer, awareness and early action remain our most powerful weapons. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. Your pancreas and kidney health are more connected than you might think. In fact, poor pancreatic function can be one of the warning signs that your kidneys need attention. The sooner you spot kidney issues, the more you can do to keep things under control. If you're unsure about your kidney health and haven't been in a good shape recently, check out the video on the screen. Here, we cover all the possible symptoms, helping you spot kidney failure and take action effectively if needed. See you there, stay informed, stay healthy.